Do you have a normal period? Do you even know what a normal period is? Today, we're starting a new series. We're taking it back to school. It is August here in Florida. My kids just went back to school. I think many kids are going back to school right now. We're taking it back to school when it comes to hormones, and we're talking about what we should have learned about our bodies, about our hormones back in school. So today we're talking about what the heck is a normal period? Because if you're struggling with hormone imbalance, right, your period could be off, and your period is like a vital sign. It can be telling you what is off in your body and what hormone imbalances might be going on. So stay tuned. You don't want to miss this episode.
Welcome to She's Healthy, a podcast for ambitious women on their journey to become the healthiest version of themselves. I'm your host, Lori Aikman.
All right. Welcome back to the She's Healthy podcast. My name is Lori Aikman. I am a functional medicine nurse practitioner based out of Florida. Before we dive in, I'll quickly give you my medical disclaimer. I am a nurse practitioner, but this podcast is for informational purposes only. It's not meant to diagnose anything. You want to just take the information that we present here. Go talk to your doctor, have a conversation with them, consult with your provider before you make any changes to your health. All right, so let's dive in. So we're going to talk about today, I'm starting a new series again, back to school, learning about what we should have learned about our hormones, about our bodies back in school, right? It would have been great if in health class we learned about these things, but I believe many of us did not. And I will say, even as a nurse, right, I learned about the reproductive cycle and periods and things like that, and learned about them in nursing school. I'm pretty sure. I know I had an OBGYN semester in nurse practitioner school, but I'll be honest, I didn't really retain any of that stuff until I really dove into functional medicine and working with women on their hormones. Then really paid attention to it a lot more and really dove in to understand it. So even as a healthcare provider, I didn't really have a good grasp of it just because I didn't deal with it in my day to day. So it's not surprising that so many women out there are misinformed about their own bodies and don't even understand certain things about their own bodies. But what I'm here to tell you is that your period is like a vital sign. We have to think of it that way. Your period really tells you about what is going on, can tell you about what's going on with your hormones, but how do you even know it's normal, right? I don't think I was ever told it was normal. And I think because a lot of us get told if it is abnormal, well, we'll just put you on birth control. So who really cares about what's going on anyways? We're just going to go on birth control anyways. So today we're diving into what's normal. And then you're going to want to stay tuned for future episodes. We're going to be diving in to the hormones, estrogen, progesterone, ovulation, even birth control, how those impact your cycle, PMS, things like that. All right, so let's dive in. What is a normal period? So I had a request from a woman. She commented on one of the YouTube videos, just like it would be great to have some visuals. So you asked, we answered. I'm actually just going to pull up some slides from our presentation I did, gosh, almost 2 years ago now. So you have a little bit of a visual what we're talking about. So what the heck is your period, right? Our period, we know, like we bleed, but what actually is going on? So let me pull this up. Okay, here we go. So you guys have this little, hopefully you can see this. So the period, when we talk about your cycle, your menstrual cycle, the menstrual phase is actually, that period, that part where you bleed. That is one of the 4 like cycles in the full month or 28-day cycle. So most women have an average of a 28-day cycle. So this menstrual phase, your period, your bleed, things like that. What's actually happening is that the bleeding is coming from your uterus. And let me take it back right here. We'll go back a little more. Oh my gosh, I know. Okay. So if we look at, okay, what the heck is your uterus? Maybe you've never learned this before. So this lower part here, hopefully you can see my cursor, is the vagina, right? That's, where your tampon's gonna go, where, things go when you're having sex. You guys get the point. Then up here is your cervix. So this is kind of like here's another one. When we do a pap smear, the cervix is actually the area where your doctor, your practitioner is actually swabbing and collecting cells from. So when you look at it, if you looked inside of the vagina and you looked at the cervix is like a donut shape. Here we're seeing a cross section, but actually kind of looks like a donut when you look at it straight on from the inside. Then above that is the uterus. Uterus is our baby maker, for lack of a better term, right? So when a woman is pregnant, that is where the baby grows, right? So we have to think our period, like part of this cycle, these are reproductive organs. So we really have to think about things and going on with our hormones in context of reproduction. So when we, kind of a quick overview, we'll dive into each of these phases throughout these next episodes, but essentially is happening when we are, let me move over to another slide. When we're going through the month is let me back up. Oh, that's probably too confusing. Sorry. Is our ovary is gonna release an egg, that ovulation, right? Ovulation, the ovary, if you're not, and I should say, if you're ovulating normally, if you're of reproductive age, so if you're not on, hormonal contraceptive that's keeping you ovulating in a normal month, your ovary, so you have two ovaries on the sides, the ovary is going to release the egg. The egg is going to travel through the fallopian tube. If it has the opportunity to combine and does combine with a sperm, then a embryo can form, which is the beginning of a baby, right? The two cells, right, from the male and female cell are going to combine, the egg and the sperm, forming an embryo, and then that embryo keeps coming down the fallopian tube and will implant, like embeds in the wall of the uterus. So that's if somebody gets pregnant. If that doesn't happen, so if, there's no opportunity to combine with a sperm, maybe it does, but it doesn't stick in the wall of the uterus, it passes through, whatever, pregnancy does not happen, then I'm trying not to go into too much detail. There's really so many tangents we can go on here, but pregnancy doesn't occur. There's no embryo implanted into the wall. So then what happens is we progress to our period. And then in our period, in that menstrual phase, what happens is some of the tissue of the uterus, so some of the uterine wall actually sheds off. That's where the bleeding comes from. Okay. So that's actually what's happening when we have a period. I will let you know if you are on hormonal birth control, if you're on the pill, for example, and you're going to take those 3 weeks of the regular pill. And then that fourth week, it can be 7 days, 5 days. Those are actually placebo pills. They don't have any hormones in them. And what happens is you actually have a withdrawal bleed. And just from the decrease in the hormones, right? You're taking hormones and then you don't have hormones in the other pills, you have what's called a withdrawal bleed. So there is some bleeding that happens, but you haven't had the change in the uterus like you would in a normal period when you're not on the pill. I hope this is making sense. So let me go over to that slide. So that's just a little bit of background of, okay, what is actually happening. And so when we actually talk about your cycle, like a lot of times I'll say, how long is your cycle? And women tell me like, well, I bleed for like 5 days or something like that. But when we were talking about the cycle is actually the full, month or 28 days or whatever that you are experiencing. And so day 1 of your period, and you can have some spotting, right? So a lot of women will spot before they actually start to have a full bleed. It's the first full day of bleed or first day of significant bleeding. That's day 1 of your cycle. And so during that period when it's bleeding, you can see here on the slide, but 1/3 of the uterine lining is shed, comes out in blood, and then the rest is actually reabsorbed. Okay. So what the heck is a normal period? We'll talk about, and this is backwards, we'll talk about length. So it's actually normal to bleed anywhere from 2 to 7 days, which is broad range. I think most women I hear are somewhere between 3 to 7, maybe an average of 5 days. but that's a typical length. So you ladies that, don't bleed and are skipping cycles, right? That's not normal. Or you ladies that are having these really long periods where you're bleeding for like 10 days, right? That's not normal. Anything over 7 days. And then the flow. So, right, this is something no one I feel like talks about. And I always thought, I will say just on a personal note, I always thought I had like heavier periods, but I didn't really know like how much is heavy. So your normal flow is an average of 50 milliliters. Or it ranges anywhere from 25 up to 80 milliliters. Okay. So like how, I don't think many people are measuring, right? So how do we calculate that? So about 5 mLs is a teaspoon, and this would saturate a regular pad or a tampon. Right. So think about that. If average is 50 mLs, so the average woman then would go through 5 regular pads or I'm sorry. Am I saying that correctly? 10, 10 regular pads or 10 regular tampons during their cycle. That's average. Or a super tampon can absorb about 10 milliliters. So on average, right? It would be about 5 super tampons over the course of your period, right? I know a lot of women, myself included, that are on the much heavier than this, right? Right? Just much, much higher. So then your low range would be about 5 regular tampons. Your high range of 80 mLs would be about 8 super tampons. I mean, I know people that go through that in a day, right? So if you're using more than 8 super tampons, right, you technically have a heavier period, which can be indicative of some hormonal, right? When we have changes in our period, it's indicating that there may be something off in our hormones, right? We have to think about our period as being a vital sign, okay? That it's telling us, right, as a measurement of what's going on in our body. So let's keep going. What about color? So normal color is going to be, red to brown. If you have anything other than that, there could be, you could be having an infection going on that's, creating some discharge and changing the color, but that it's going to be more red, more bright red when the flow is fast. And when the flow is slow, it's going to be more brown. So I know a lot of women that maybe have spotting, and it can be more brown. That can be indicative of some hormonal changes, which we'll talk about in another episode. And then what's normal as far as clotting? Some women don't clot at all. Some women do clot, but clots shouldn't be any bigger than a dime. I should have put a dime. I have a little hair clip here from my daughter, right? These little mini hair clips. I would say this is probably more like the size of a nickel, right? So clots shouldn't be any bigger than that, right? And I know there's many, many women out there that are having a lot bigger clots than this, right? So let me show you a visual. And again, I should say, if you are listening on one of the podcast platforms, I would recommend coming over to YouTube and checking out this episode on YouTube so that you can see all these visuals. But you can, again, hear these normal ranges. But right now we're looking at in the video. So this is kind of like a picture of what is happening in the uterus. So again, we talked about, okay, in that period, our uterus is shedding, remember, a third of the uterine lining, right? So a third of that uterine lining, about a third of it is shedding, and that's where the bleeding is coming from. Right. So that's where this is kind of an example. What this picture is showing, it would be like cross-sectional of the uterus. So it's going from at the beginning of your period, your uterus is really thick, to you have your period and that uterus will thin out. So we'll talk about in subsequent episodes then what happens. So your period ends, and then you move into what's called the follicular phase. You have ovulation, and then you move into your luteal phase. And what you can see in this picture is that the uterus lining is going to get thicker, right? And part of that is that right, if we think about it from a reproductive standpoint, your uterus is your body is getting your uterus ready to receive an embryo, right? And so if an embryo is not received, pregnancy does not occur, then we have, right, our next period, that'll happen, and that uterine lining sheds again, bleed happens, and that uterus then thins out. Okay. So that's actually, right. I don't think, again, the stuff we should have learned when we were growing up, but we didn't. I should say, the average cycle is about 21 to 35 days. Where is it? Yep, there. 21 to 35 days in length. So basically you're having a period every 3 weeks to every 5 weeks is kind of a normal range. I know many of women who, like for PCOS, for example, might skip a period or have really long periods, like where their cycles are 45 days, 90 days, things like that. I'm going to skip this. I want to show you too, just quickly, some other things that are going on. We're going to break this down. So this is just a picture you'll see if you Google menstrual cycle and like click on images. This is what you're going to see a lot of, is this chart showing at the bottom is what I just showed you. So the uterus, increasing in thickness and then decreasing in thickness throughout the cycle. You have change in hormones coming from the ovaries, which are estrogen and progesterone. You have changes in the hormones coming from your pituitary, which are the FSH, follicle stimulating hormone, and the LH, luteinizing hormone. And then you also have changes in your body temperature over the course of that cycle, over those 28 days, 30 days, 35 days, whatever you're having. And then you can see at the top here, again, we have, part of this is occurring because if you're cycling normally, if you're not on birth control, if you don't have an IUD, you don't have Nexplanon, etc. If you're having normal cycles, you're going to ovulate mid-cycle. Your ovary is going to release an egg. Something called the corpus luteum forms. And then the cycle starts all over again. Your ovaries will take an egg, they grow the follicle, which is like the supporting sac around it. It like gives it nutrients and stuff. At ovulation, that follicle gets released, corpus luteum forms, and then if again, pregnancy doesn't happen, that corpus luteum is going to go away. Okay. So I'm going to keep it there for now. We're at 20 minutes in, but I would love to hear I would love for this to be a really interactive series. So if you're listening to this, please, 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 if you are on YouTube, leave comments. Let me know what you want to know about. I want to make this really educational, really helpful for you, to help you understand your body. Again, we're going to go into these different phases. We're going to talk about what it means when things are off and what are some signs you can look for if your period is not normal. What might that mean? Okay. I want to put this out there. So for this, we're planning this series to run about 4 weeks. Again, if you didn't hear me say in the beginning, I am a nurse practitioner in Florida. I have a direct primary care practice. I also have a health coaching practice where I have health coaches that work with women that are outside of Florida. For these 4 weeks, we are doing a promotion. I talked to so many women who tell me, I've had clients tell me, I went to my doctor because I have those hormone imbalance symptoms. I asked for them to test my hormones and they refused, or they told me there's no point in testing my hormones because if they're off, we're just going to put you on birth control, right? I see so many women getting gaslit by their providers, or maybe their providers. I will say this, back years ago, I didn't really know how to properly evaluate somebody's hormones. So you might have a provider who's like, can you go to your OBGYN for that? Right? And then, from your OBGYN, you may get them to test your hormones. I think a lot of times they will. I think sometimes they just, they say, well, if anything is off, we're just going to recommend birth control. So if you can just choose birth control rather than getting the hormones done. Anyways, because of that, we are doing a functional hormone check again for the 4 weeks of this, these series going on. So what you can do, what this includes is it includes an initial visit with myself or one of my health coaches. We're going to a hormone panel on you. We're going to check your labs. And just in the blood test, we're checking hormones in the blood. We do advanced testing, but those are usually bigger tests that are more expensive. And so we're just doing, basic blood test here of hormones. Then we're going to do a follow-up visit with you where we're going to give you a functional hormone report. We're going to talk about, okay, this is what we see in your labs. This is what's off. Here's what might be going on so that you can get some answers. I know so many women. Again, I see it in like these group chats and these threads. I see it in comments on social media, like that people won't check their hormones. So we're giving that to you, right? You don't have to commit to working with us. You can just get your labs checked, get some answers so that you can get some clarity about what is going on in your body, and then can decide what your next steps are. If you do want to go on the pill, or if you do want to have hormone replacement, or whatever is going on. So if you're watching this on YouTube, I want you to comment hormone in the comments below. If you are listening on one of the podcast platforms, I will put a link in the comments below where you can schedule a call with our team. You don't have to necessarily, jump in. You can schedule a quick interest call with our team. And I want you to, note that you're interested in the functional hormone check. And then that way we can get you signed up with it for it, get your labs drawn, and get you some answers. All right. I'm super excited about this series. I hope you guys are too. Again, send me your questions. Help me help you. And I will see you next time in the next episode.